Today, what we're speaking about really is just one small piece of a very big project, and that's around some of the new technologies. There's a lot of things that we could say. I want to point out in terms of the core principles that where we started from and where we're going to end up is really around relationships and humans communicating with each other in a more effective way that is more collaborative, that is more meaningful in terms of the timeliness of information. Yes, efficiency and getting every last little drop out of our resource is very important also. But at the core of it, technology sometimes gets sort of detached from what it means to be human. In fact, I think this is going to be the thing that binds us even tighter than we have to this point. A part of that, I think, is to say that the opportunity we have on the new St. Paul's campus, specifically as it pertains to revolutionizing systems of care for patients, is tremendous. And as we have a chance to talk about this probably afterwards, some of the opportunities around each of these things is really meaningful. Today, we're just going to speak about really one thing, and that's around information, access to it. Each of the speakers today have spoken about, in one respect or another, chronic disease or surveillance around a potentially life-threatening disease. So, of course, every little part of what we're doing is focused on patients, access for clinicians to interact with the patient record. This means that somebody who is sick in San Francisco when they're away this weekend can pull up their record, what their genome sequence indicated their risks are, in a way that's just not possible today. So all of these information systems will eventually filter back to helping specifically patients and families, and that's at the front of that. The thing we want to emphasize today is just one piece of that. Really, that's kind of the other side. That's our hospital systems and how we would be interacting with data increasingly in the future. This is around the concept of an operations slash sort of command center. You know, at the bottom, you can imagine in YVR what it means to be safely transporting and directing flight paths and landing and so on. That concept made its way to the US. The place that we saw most recently was Johns Hopkins. And then in Canada, the leading digital hospital to this point, which is really Humber River, they're also doing the same. This has meant a tremendous opportunity to take what have been very siloed departments and ability to actually look at the whole through information systems. And as we are on the precipice of shifting to a new information system where a lot of this is going to be enabled, we're, again, uniquely positioned as the first academic institution to be taking on this new information system, to be looking at many of these things. The first piece is around simple descriptive analytics, just displaying what the pressure is in the emergency department or in a particular ward, what's happening in the front hallway. That's just a display of what is happening, and it really gets to the concept of dashboarding and displaying kind of what the mean or averages are for various services at any given time. Most places, including Humber probably at this time, are really in that phase. The next phase, which gets exciting, is around prediction and being able to say, right, we know that the emergency department is 10% or 15% more occupied at this time of day than it usually is. What does that going to mean for our discharges at the end of the day or the end of the week or next month, in fact? And so we move from this sort of predictive model to perhaps being able to manipulate some of those factors, saying, well, we could experiment with, well, what do we need extra capacity in September and October of certain years based on weather patterns? Is that going to mean that we're going to have a greater problem with our discharge at the back end? And there's tremendous opportunities to look at what that could be. And then finally, that goes to the concept of wearable technologies and digital health, where patients are going to be increasingly, as Nardia mentioned, hopefully not in this hospital, but sometimes we're going to be monitoring them. So they're going to be discharged home earlier, and we're going to be relying on their wristwatch to be reporting whether they're having early arrhythmias that they're not aware of. This gives us an opportunity to actually follow them from afar, and perhaps before they even know it, we can be discharging a nurse to their home or having them come in for an assessment in one of the clinics. increasingly, as our integrated information systems deliver more and better data, it's going to be able to, prompt some improvements in flow, some things we haven't even been aware of. Perhaps if we're linked into the primary care network and there's a series of sick leave in one of those primary care networks, it's going to have an effect on us. There's going to be fewer visits to a particular network. It's going to be in higher volumes to our ED. Just having that information may be important for us to plan how we use our resource.